Hi, Lupita. Was probably chasing Roger around the house.
No, he's with my brother right now.
Oh, okay. Is that who's the regular iPhone?
Oh, I'll make it, I'll mute it. Hi, Samantha. It's Virginia.
I was like, I know that voice. Hi, Virginia. No drama, no trauma this week. We're all here, not on the side of the road, getting kidnapped.
No.
Good.
That's really good, Miss Kai. I'm really happy to hear that.
Thank you. So I'm gonna pause it. Just okay, perfect. Okay, so how this is gonna look is, so I gave you a homework assignment last week, and I asked some things that you wanted to learn. I thought they were really great, and one thing I thought it was going to be very consistent. So there were some very consistent things like the NCLEX questions, which we will always continue to do. Pharmacology. I got some really things that I didn't think I was going to see, and I'm like, okay, this looks great. Let's do it. So what I'm going to do is, so we're not doing that today. That's going to be next week, only because I'm just going to be honest. I didn't finish it. I wanted to make it into a Jeopardy. And then I was like, well, we just did Jeopardy, but who cares? So I'm making it into a Jeopardy. Why not? Because it's a perfect amount of lines and everything. So everything that you guys were interested in. So we'll do an NCLEX one. And then someone wanted to talk about, for example, antibiotic therapy. Somebody was interested in pharmacology. We'll do something else with that. I am going to add diabetes on there. That wasn't someone's request, but I am. Your homework today has to do with diabetes, because I think that we need reminders on insulin. How do you mix insulin? That's what I'm doing for the kids tomorrow. I'm going to talk to them about why and how, and why can't you mix this insulin with this one? And because I know they're doing that right now. And I've heard that it's been a struggle, and it's not being explained. It's just clear before cloudy or short before long. Why? If you know the why, you're going to remember more than likely. That's kind of the evidence-based practice that I follow. So your homework is a little bit different than what we're doing today. So that looks a little weird, but I put a blurb at the top to explain why I did it this way. So they're very short videos. It's Nurse Sarah, I love her. With the one with the accent, the purple lady, as Alfredo made the movie. I don't know if I told you, and I showed it. He did a great job. I think it was really helpful for the class. Except I didn't know someone in the class. Are one of you his girlfriend, by the way? Before I say this.
No.
I love it, Rosa. No. So I was like, okay, girls, don't get excited. He's cute. And then someone in the class, I knew it, was gonna know him. And they're like, and he's got a girl. And I was like, I know. And he has a girlfriend. I was like, shit, of course.
Is that his girlfriend?
No, and I asked her, I was like, are you his girlfriend? And no, she just knows his girlfriend. I forgot we're recording. But whatever. It was just funny. Because he's charming. He is, but it's him. So once it's like more like an annoying little brother. But no, he did a great video, and it was really helpful. So just like when you guys, I had a couple of you come in and talk to the class as well. So anyhow, reminders are good. So clear before cloudy. She talks about, she does this thing. So the last video, you have to cut and paste it. If for whatever reason it didn't pop up as a video, it's a little bit confusing. So honestly, if you have the time, watch it twice. But even if you take two things away from it, it's really helpful. Like one thing, it talks about Lantus, and Lantus is the longest acting 24-hour insulin. And that's really important to know. Why? Well, because it's 24 hours. Why else? You can't mix it with anything else. And if you know that, you could catch a mistake in a MAR and save a life. And she talks about all sorts of other things. So, and when we do our stuff next week, I'll ask questions like, what if you give too much insulin? That might be a question. What would you give? Glucagon, stuff like that. So I will take a couple questions from the homework. I think total, and I put how long each one was. I think total it's like 8 minutes. It's like 22, 23 minutes, I think, of videos. And then all I ask is just like 3 sentences of a summary. That's it. So homework is pretty easy, but it's a good reminder because this stuff is important and we forget, right? And you guys are not in clinical as much. And a lot of this stuff, like if I ask you questions about insulin right now, honestly, and be honest, you guys, do you think you would at least get, I mean, you get a couple right, but, or hopefully a lot right, but don't you feel like you would maybe struggle a little bit because you're not doing it as much?
Yes, because in clinical, we just do the pins, or like we don't do any
Yes.
mixing. It's no, we have not that much practice.
Perfect. Not perfect that you're not getting it, but perfect. Okay, good. Because I sat here thinking, what could I do that's beneficial? Because I don't want busy work. I want something that's actually going to help you. So this good. So please watch the video because I'm telling you right now, if you end up in skilled nursing anywhere, insulin is huge. And you want to, and it's very important. Remember, always 2 checks, all that stuff. So anyway, okay. So that was kind of the method behind all that. Next week is when I will utilize what you guys wanted to learn. Today, we're going to finish up a couple things. So we had like, I think 10 questions left on our Jeopardy. We'll finish those. They're fairly short because the NCLEX ones are pretty much done. I have 2 NCLEX questions. And then I have one very, very, very short, I think it's 3-minute video on therapeutic communication. Now, this is an actual student. And the reason I chose it is because communicating with your patients and being able to communicate in an effective way is so important. And I want you to see, so this is a student who has a lot of experience. He's about to graduate basically from a BSN program. And it just shows from, I'm hoping to give you some more confidence if you have trouble talking with patients, because a lot of newer nurses or nursing students have, they kind of freeze and you might get asked a really bizarre question and you don't know what to say. I wanted to show it to you, and I showed it to last week actually too. The real babies, the first semester. And I just want you to, I want you to take note of his body language, his voice, how he's saying it. And he's actually talking to somebody who comes in on a psychiatric hold. So somebody that tried to kill themselves. So I think it's a pretty good learning lesson as well. So let's first of all start by finishing up Jeopardy. And we should be done at about 2:45, 2:50 if we stay on track. So Rosa, keep me on track. Okay.
Yes,
That's your job.
I'll take it serious.
Okay. No, you have to make me take it serious because I'll get off track. Okay. So can you guys see the screen of the blue?
Yes.
Okay. So let's go ahead. So it goes in order like this. So Lupita's first, then Virginia, then Rosa, then Leslie. That's just how you are on my thing. It's not who I like most. It's just how you are on my thing. So Lupita goes first. If she doesn't know the answer, she picks, doesn't know the answer, just say next, then Virginia, then Rosa, then Leslie. So go ahead.
Okay. I'll have sleep 200.
Sleep for 200. Okay. Name one medication over the counter that is sold to help with sleep and one prescription medication that can be prescribed to help with sleep.
Okay, let me think. Okay.
Yeah, you can think. And the over-the-counter one doesn't have to be specifically for sleep. It could be used off-label. So it could be for something else, but it helps you sleep.
So like, does it have to be like a certain thing? Like I know melatonin helps you sleep. So.
Yeah, that's boom, right there. So that's your over-the-counter. Another one would be like
Okay.
Benadryl, things like that. Perfect. And now what about one prescription medication?
Let me think.
Think of commercials, butterflies, addictive ones that Miss Amanda says don't take. but if you take it, it's okay.
What was it? What was it?
Starts with an A.
Like butterflies.
That one's actually Lunesta, but this one's very closely related to it.
Is it Ambien or something?
Yeah,
like that?
yeah, exactly. See, you know it. Good job. Oh my God, for a second, Virginia, I thought that was a marijuana leaf, but it's a pineapple. Do you see right here? I was like, what are you doing? Awesome. See, good job. Sometimes it takes a minute, and I put question marks because there's like hundreds of meds. Okay, perfect. All right, Virginia.
Okay, let's try true or false for 400.
All right. True or false? 8 grams is equal to 8,000 milligrams.
True.
That is true. Good job. See, good reminders, right? Just
Yes.
brain go. Excellent. Rosa.
Medication for 300.
All right. What is the other name for Benadryl? Everybody hates this question because no one can say it.
Is it Sudafed?
Try
No.
again. It's the one that everyone hates to say. It's long and it starts with a D.
Diphenhydramine.
I'll tell you. Yes. Actually, you said it right. Diphenhydramine. That's excellent. So diphenhydramine is actually, that's the active ingredient in Benadryl. It's the same thing. It's like Waldryl. It's the same thing. So if you're going to the store, it's cheaper. I mean, in my opinion, why buy save $2, right? Very good. Diphenhydramine. And remember, on the NCLEX, they use the generic names. So that's why it's good to know the generic names, or at least be able to recognize them. Perfect. All right, Leslie.
I'll do sleep 300.
All right, because you're tired. I am. I'm so tired. Okay. Once darkness starts, what hormone starts to become activated in the brain? Lupita kind of mentioned it. Actually, she mentioned it earlier. It's sold over the counter, but your body actually makes it too.
Pass.
Lupita, you're going to get the same answer.
Melatonin.
Melatonin. Yes, exactly.
Oh.
So, and a lot of people actually don't know this because, so first and foremost, hormones come from glands. Does anyone know what gland this comes from? It kind of sounds like penis, but it's not penis.
Pituitary. No.
Close.
Pin,
But yeah, say it.
pin,
Yeah, I say it
can't
like that
say
too. I know that's why people make fun of me. I say penile. It's penile, but it will always be penile to me. And that's how I actually remembered it. So basically, your pineal gland secretes. It's in your brain, and as it gets dark, and the peak hours, and this isn't important, but the peak hours are midnight to 2 a.m. is usually when the most of you'll find the most melatonin in the system of your body. So we make it, and we can also buy it over the counter, and it is not considered addictive. So it's pretty cool. We make it, and that's why it can be so hard when you switch shifts all the time, back and forth, and your whole like circadian rhythm gets thrown off. Very good. Okay. So yeah, we'll let Guadalupe go again.
Pain brain 300.
I never realized that kind of was funny. It's pain, your brain is probably in pain. If a patient was given too high of a dose of an opiate, which medication will reverse this? This is very important.
Is it the naloxone or I don't know? Not
Yeah,
Is it an N, right?
it actually, so technically it is. So there's 3 kinds. So it's called Narcan. However, naloxone is just a longer form of Narcan. And then there's a longer one called naltrexone. But the main one that you'll want to know, like if you were taking it on the NCLEX, it's called Narcan.
Okay, so Narcan.
Narcan, yes. So it's wonderful. It saves many lives. It's actually over the counter now, or given out free, which in my opinion is very wonderful because a lot of lives are saved. Beautiful. And it happens in the hospital too, right? Mistakes, and we can save people's lives. So Good job. Virginia.
Okay. The body 400.
All right. Where is the apical pulse found?
So the apical pulse is found by the S1.
Which is not untrue. Now, if you had a body standing in front of you, or your own body, so here's what are you doing, Violet? Sorry. So is it on your, you know how you go from your mid clavicular? That's how we usually say it. Is it on the left or on the right?
It's on the right.
So is that right, guys? Right, left? Is it the left?
On the left.
Oh,
To
wait.
the left.
It's left, right? Okay. Now you've got me confused. I'm like, wait a minute, is it?
No,
So
it's the left, right?
Yeah.
Left
it's left mid clavicular.
clavicular.
And then how many ribs down? And it always falls, and we're all women on here. Yeah, it always falls right on our boob.
On the fifth clavicular.
Exactly. Perfect. Excellent. Which can be very, very tricky if you are a busty woman. Have them lay down so that hopefully they'll fall over if they're real. And if they're not, if they're not, then you move them with this part of your hand, right? You don't grab it like this. Like I had my student. Was that you guys that I told, or the other one?
No,
It
you
was
don't
like,
cup it. You.
it was the best day. I think that was the day I threw up because I was laughing so hard because this girl had the biggest boobs or breasts, and this poor like nervous student, and they were both girls, and I did it on purpose because a guy probably would have fainted, because you have to touch each other, right? And she was so nervous. She had already poked herself with a needle that day that she went like this, and I was like, but she still couldn't get it up. Like it was like big, it was like as big as my head. And so I just said, it's fine, just go, just do it up here. Just do it up here. It's okay. It's okay. Because as long as you know where it is, and we didn't have a bed available, so that was a good day. That was a really good day. We still laugh about it. You have to have fun, right? You're like, not at heart now. Miss Espy would not like that. Okay. Oh my God, I can only imagine. Is it Rosa's turn?
Yes.
Okay, sorry, I'm thinking about breasts now. Rosa.
True or false 500?
True or false? 500. True or false? Controlled substances are considered to be possibly addictive.
True.
That is absolutely true. They are called scheduled or controlled. Good job. All right, Leslie.
I'm sorry. It's because I'm still laughing. Okay. That was funny.
It was the best.
I'm just laughing at that we have to have fun, and then we use.
I mean, I probably have too much fun, to be honest. But that's okay.
I'll do
They like it.
true or false.
For what? How much?
100.
Okay. So true or false? The liver is located on the right upper hand quadrant of the abdominal cavity. So your stomach is on one side and your liver's on the other.
Wait. What does it say? On the right upper hand?
Yes,
Yes.
you are correct. And then your stomach is on the
Bottom or under.
it's on the other side.
Yeah.
You're all, it doesn't matter. You got the question right.
Miss Kai, you want to know the only reason like I would remember that your stomach, like your intestines are on your left side? Because one time when I went to the hospital because I had a really bad like stomach pain,
Yeah.
the doctor didn't think it was appendicitis because it was on my left side, and you normally get pain on your right side. So she's like, no, she's like, you can't have pain on that side. That's your like where your intestines and your. I'm just
You
like,
have referred pain.
well, I'm like, I have pain, She's like, I don't think it's anything, but if we'll just do an MRI just in case, but I know it's gonna be nothing. And then when she came out, she's like, "Oh, we need to do emergency surgery."
I
honey."
love it. I mean, and I don't love that you had to have surgery, but I love that. Oh God, we're gonna be better than that, right? We're gonna be
Mhm.
better providers, and we're gonna advocate for our patients. And did you have your appendix hopefully
Yeah.
taken out? Okay.
I did.
Oh, that's quite the scar I hear.
And well, actually, it was just I did it. They did it laparoscopically.
Oh, they did?
Yeah.
Oh, cool. Good for you.
So it was just like 3 little dots.
Oh, I was just gonna ask you something personal, but did you have a C-section? You don't have to answer that.
No, I did
Okay.
not.
Okay.
It was a vaginal birth.
That other thing it comes out of. Well, it only comes out
Hey,
one of two ways.
My nephew seems to think that it comes out from the butt. So
Just let him think that.
yeah, he was like, Pita, I know babies come out of your butt, but and then he just like came out. I was like, what?
How old is he?
He's 10.
Oh God. Oh, just yeah. Let him be young. Let him think that.
It
Did
was
you
funny.
get the question right? You did. You did. Yay. Okay. Virginia.
Oh no, I haven't done it. It was
Oh.
that was the other one, the last one.
Oh. Oh, that's right. Because we were talking about the stomach. Okay. What would you like, my dear?
The body 100.
Okay. Body. What organ is involved in diabetes? Better get this right.
Is it the kidney?
Are you Lupita? I will come.
No. It
liver.
is
Wait, she
Just
just
by the stomach.
did she just leave?
Yeah.
Yeah, I think so.
What?
Maybe I kicked her out.
Did I scare her? Okay,
Probably.
everyone say it together. What's the answer?
No. The pancreas?
The pancreas. Yes. she just bounced. She's like, I don't know, bye. Oh my God. Okay, so the pancreas. Perfect. Virginia.
Okay, so we'll do the NCLEX question for 100.
All right. Oh, there she is. Mhm. Bounced out, huh?
I'm serious.
It's the pancreas was the answer.
Yeah.
Okay, so Virginia, the school nurse notices a group of children on the playground surrounding a child who appears to be choking. The nurse observes that the child is conscious and coughing. So that's good, right? Because that's what your body should do. So we're happy about that, or I'm happy about that.
Mhm.
And the child reports, I'm sorry, the children report the child was eating raisins. Which action will the nurse take first? So I'm looking at that. Okay, child is eating raisins. More than likely is probably choking on raisins, is conscious, which means this little guy is still coughing and is still breathing at this point. That's good. I like it. So
Mhm.
what am I going to do? The first thing, number one, encourage the child to continue coughing. Number two, instruct a teacher to call 911. Number three, ask the child to speak. Or number four, begin abdominal thrusts. The first thing, the very, 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 very first thing. This is a hard question. I don't know.
You
why.
would encourage the child to continue coffee?
Yeah, good job.
Okay.
Yeah, no, a lot of people pick number two because it's scary as all hell to see a child. I mean, anyone choking, but a little guy, oh my God, it's like terrifying. But yes, because your body knows what to do and the child is conscious. Now, if the child was unconscious, what would we do? We would say, call 911, and then you would start abdominal thrusts. So actually, all of these are correct, but what are we going to do first? Cough, cough, get that out. Because usually they're able to get it out on their own. Good job. Okay, now you guys are all out of order because Lupita like bounced on us. Is it Rosa's turn?
Yes.
Okay.
Or wait.
Or-
Oh yeah, yes.
Okay.
The body 500.
Okay. What are two classifications of
Did you-
Tylenol?
did you
And
choose
what
the right
is-
one?
What?
Did you
Probably
choose-
not.
Oh, okay. Well, I'll
Probably
just
not.
listen.
Sorry. I'm sorry.
I have two.
Classifications of Tylenol. Like, what are two reasons why you would take Tylenol, and what's the other name for it?
Acetaminophen
Good job.
and for pain and fever.
Look at you. See, you don't shoot. Did I give you? I don't know what I gave you, but you got it right. Good job. That's exactly right. Good. Leslie.
Sleep 100.
Okay. Name 3 reasons why sleep is important for well-being of any patient. This is all you. You can, I mean, there's no wrong answer. I mean, I guess
So 3 reasons why it's important. Hold on. Oh, I went blank.
so
So I know why it's important. So
I can help you if you need help. Like think
Healthy-
surgery.
oh, it hold on. Everybody needs sleep. It helps with healing.
Yeah.
Process.
Yep. That's
Oh,
the
I
one
don't
I'm
know.
hoping everyone says. Healing, yes.
Healing. It's like this is an easy question, and I don't know how to
Because it's
answer
too
it.
easy. That's the problem because
Okay,
it's too
and
easy.
then
Think about what's
oh,
happening
so-
to you right now. Are you sleeping
okay, so
well?
you need to sleep. What was that?
Think of what's happening to you right now.
Okay,
Is it
so
hard?
my brain can work. like,
Yes,
so it can
exactly.
function.
Yep. There's
Um,
2. What's the third?
I need to get some rest, refresh, so my body works, so I'm alert, so
Yep.
I can function.
I'll take it. And I'm going to give the third one. And again, this is just, I think it's important to understand is that, so healing is the one, honestly, I'm looking for. The other 2, not that I don't care about them, but it's really healing and well-being. One that I also really, really want you guys to understand is that when you are sleeping and you're getting good sleep, your neurotransmitters in your brain replenish. So that serotonin, the dopamine, glutamate, norepinephrine, they replenish. So if you're not sleeping well, they're not replenishing. Your brain is going to have a lot of trouble focusing. It's nursing school, basically. So we're all screwed, basically, right now, but not forever.
Mhm.
I promise. Good job. See, you got there. You just need you're not getting enough sleep. You need a little more time. That's okay. Lupita,
Medications 400.
are you okay?
Yeah.
What is the medication classification of Prozac? It's an anti.
To be honest, I don't know.
It sounds how you sound right now when I said, "Are you okay?" It's an anti.
Mm.
I feel sad. Anti. Pretend you're sad. Not
Mm.
anti-anxiety, not mood stabilizer, anti.
Mm.
I'm sad. I need medication to help me not feel sad. So
Oh, sorry, an antidepressant.
got it. Exactly. Good job. The other name for it is called fluoxetine.
Okay, fluoxetine and Prozac. Okay.
Good job. All right. Virginia.
Let's do 400 pain and brain.
All right. What are some executive functions that the frontal lobe is responsible for? You can just name 1 or 2 or however many you want. So your frontal lobe, I'll name 1, impulsivity.
I don't know this one.
Critical thinking,
Plan.
Critical thinking, impulsivity, and
having good making. So if you were, let's say, taking a test and we were in class and Miss SB was talking, or let's say you weren't even taking a test, she was lecturing and it was anywhere, and you were just like, you disagreed with what she said, you're not gonna scream out, "You stupid bitch," right? We wouldn't do that. You wouldn't do that, right?
oh no, no.
Okay. So that your frontal lobe helps be responsible for that. So you're not impulsive, and it helps with your judgment. So your judgment's telling you that's not what I'm going to do. I may not like what's happening, but I would not say it in that way. So critical thinking, judgment, impulsivity. So the frontal lobe is very important. If somebody has frontal lobe damage, it's usually pretty, unfortunately.
Judgment and good decision making. Oh, okay.
Exactly. Perfect. See, now you know.
Thank you.
You are most welcome. Okay, you guys, bring us home, Rosa.
The body 500.
Body. All right. What is pancreatitis in the most simplistic explanation? Just
It is
break down the word.
infection in the pancreas.
Is- What does itis mean?
Inflammation
In the
pancreas.
Yay! Exactly. So basically what happens is the juices get turned on. So your pancreas is actually considered it can auto digest itself, which we don't want it to do. So your pancreas will spit out little bits of juices as you're eating because your intestines have a special lining which can basically handle those juices and not hopefully get an ulcer. Sometimes we do get ulcers in our intestines, but our pancreas, when the juices are in there, they're deactivated. Unfortunately, with some people who have an autoimmune disorder or who abuse alcohol or have alcohol use disorder, they can get turned on while it's in the pancreas. So basically your pancreas is eating itself. It hurts, I hear, so bad. You have to be admitted into the hospital usually for about 5 to 7 days, and you can't eat anything, because if you eat something, what's going to happen? It's going to spit out and it's going to make it worse and worse and worse. And it's awful. So we don't want it, okay? Nobody wants that. So that doesn't mean if someone says, oh, I had pancreatitis, that does not mean that they're abusing alcohol. There's 2 types. So good job, Leslie.
Pain brain 100.
Okay. Okay. So the most simplistic way, I mean, literally, what is a neurotransmitter? What does it do in the brain for you? So I'm talking, my mouth is the neuron.
So it sends messages.
Boom, right there. Exactly. It communicates. That's how your brain communicates. Perfect. Okay. Last but not least, Lupita, no pressure. What do you want? What does it mean when a medication is used off label?
When it's used for something else that it's not like meant for.
Beautiful. Do you see that you guys are learning and you remember things and like how cool that is? I don't know. Maybe it's just me. Good job. Okay, so we're all the winners. That's a pineapple. Do you guys know how to cut a pineapple? It's really easy. If you don't, I watched it on TikTok and I cut a pineapple. Does someone not know how to cut a pineapple?
Do you cut the middle?
So you actually cut off the ends and then you just slice down and it just like comes off those the spiky things. It's like, or you go from like the brown where the brown and the yellow is, and you just literally slice down and then cut chunks. It's amazing. It's so I had no idea how easy it was.
Okay,
Try
that
it.
sounds since it was from what I like how I cut it, but okay.
Oh, but hey, as long as it's safe and you get it in your body and you don't eat those spiky things, that's what's good. Okay, so who wants to be brave and take a shot at number 3? Can you guys see it?
Yeah,
Yeah.
I'm just reading it.
5 more seconds. I'm gonna pick you. Someone.
Is it-
No, you have to like read it.
The nurse cares for a client taking enteric-coated aspirin 1 tablet daily. It is most important for the nurse to follow up on which client statement.
Most important thing right there. It says it is most important for the nurse to follow up on which client statement. So are we looking for something right or something wrong? We're looking
Wrong.
for our patient to say something wrong because we're gonna intervene, right? So we're gonna remember that. So which one of these do you think we would want to intervene with if we have our patient on a blood thinner?
Probably like the alcohol one.
And that's what everybody picks. Now let's see why that is not correct.
Wait, before anything, like, I don't know. I was thinking probably like, never mind. Go ahead.
Are you sure?
Yeah, my other one was probably gonna be like the second one, but I don't know.
Yeah, never mind. So she didn't say that. She didn't say that. So this is actually a very, very tricky. It's a lot of the NCLEX questions are tricky, but this one in particular is very tricky because I almost feel like a lot of them could be the answer, really, if you read it right. So if I experience nausea during the day, I should call my healthcare provider.
I don't think so, because nausea could be like one of the like adverse effects, just a normal side effect.
And we're looking for
Most
it is
important.
most important, and which one is the most important, right? So I mean, I might want to hear from them, like if they're constantly nauseous, because maybe like I might want to switch medications. But now I'm going to compare. I'm going to start comparing which one's more important, number 1 or number 2. I understand that a daily dose of aspirin may decrease my risk of colon cancer. Would I intervene on that? No, because that's actually true. So boom, I'm gonna erase number 1 in my head and keep, sorry. I'm gonna keep number 1 and get rid of number 2 because I'm looking for something wrong, right? But I keep having to remind myself that. Then number 3, I have decreased my alcohol consumption to one beer or glass of wine per day. 1. So they're giving you the hint of 1. Now, if it said like 5 or 6, this might be the answer, but they're giving you that. But you know what? I still want to like read everything because I don't know. But between number 1 and number 3, which one would probably be more important? I'm gonna say that I would intervene with number 3 before I would intervene with number 1, because we do know that alcohol does thin the blood, right? And somebody could bleed. Now, which one is most important? And it has to do with this. So what does garlic do to your blood in high amounts?
Thins your blood.
It thins your blood. So we're afraid of bleeding. And in comparison to garlic and 1, because we're down to these 2 being our answers, number 3 and number 4, I'm going to be more concerned with this much. This is a pretty hefty dose of garlic, because I'm going to let them know that they're going to not want to be taking now garlic in their food, stuff like that. That's fine. This is actually oral garlic they're taking a high amount of, which this is going to do anyway. So your blood is already being thinned. If now we add this into it, you could internally bleed. So we definitely want to intervene. This one would be the most important. Even though I would talk about alcohol and the importance of it, this is going to be, if I could say one thing and leave, this is the one I would want to talk about. Does that make sense? Are any questions about that?
Yeah.
Okay, perfect. Excellent. Okay, who's going to be brave? And it can't be Rosa. She did one last time.
Okay, I'll try it.
That's why we're here, to get it wrong here, right? I mean, I hope you get it right, but this is where you want to get it wrong if you're going to get it wrong.
The nurse in the pediatric clinic received a phone call from a parent of a child diagnosed with asthma. The parent reports that the child is irritable and that the neck and chest itching are present. Which question is most important for the nurse to ask? What has your child eaten today? Has your child been playing with any pets? What does your child speak? Expiratory flow rate? Or does your child have a rash on his chest?
Okay, so we know that this little guy has asthma. So we know that there's already a diagnosis there. And usually if you see that word irritable, that has to do, and that has usually with a child or even with an adult, has to do with breathing. So this little guy is probably having trouble breathing. They're itching. So obviously some sort of either allergic reaction, asthma, something's happening, right? That's not good. So what do you think would be the most important thing for the nurse to ask? So we already know they have asthma. So we know that they can check this. And remember, they're on the phone.
Right.
So what do you think?
I'm between question 2 and 4. But I think I'm gonna say 4. Well, most likely he has a rash. So like, would it be 2?
But
I would've-
see, you're talking yourself through it. That's good. So in this question specifically, it's actually number 3. And the one way, even if I had no idea why, looking at the questions. Okay, so number 1, what has your child eaten today? What would a better question be? Does your child have any allergies?
Allergies.
Right?
Mhm. Yes.
So number 1, number 2, and number 4 are actually very similar questions. Number 1 and number 2. So has your child eaten today, or has your child played with any pets? And since this is not a select all that apply question, that's how, even if I didn't know it, I could easily, or not easily, but with practice after doing a million of these, which you will do, or at least 2,000 questions before your test, you'll get these little tricks down that if these two are pretty much the same thing, right? The same type of question. So they can't be right because it's not select all that apply. So it has to be 3 or 4. So does the child have a rash on the chest? What's more important? Do I want to know, are they getting air in, or do they have a rash on their chest?
Air in.
Right. Because if they're getting it in, that means that they can get it out. So and we know they have asthma, so they better have one of these at home. So we can check to see, put that stupid little thing and they blow out. So if they're blowing out, then I can be able to tell them, okay, get down here now. And that helps me get a better idea of how emergent it is. If I say, okay, mom, drive the child down, or, oh no, I'm going to send an ambulance. So I picked these on purpose. These are actually both very, I don't want to say odd questions, but they're not the normal med-surg questions, right? They're kind of different, and they're hard.
Heard of that peak expiratory. I mean, in the hospital, I know the
suck one
use the insensitive spirometer, right?
Yep, exactly. So there's a difference between that one. So that's what I call the suck one. This is what I call the blow one. And that's how I remember it. So this is checking how much is getting out. And the other one is working your lungs, and you're inhaling. This one you're exhaling, because this one's expiratory. I'm not saying it correctly, but you guys know what I mean. And the other one is, and a lot of people tell people how to use the spirometer incorrectly, right? They're like, blow, blow. No, we're not blowing, we're sucking. So, but now you all know. So even if you got this wrong, was this a waste of time? No, because what did you just learn? Now you know what this means.
Right.
Exactly.
Yes.
So it's not, in my personal opinion, it's never a waste of time. Even if you did 20 questions in a row and you got them all wrong, you just learned a ton, right, guys? I mean, that's the whole point of it. So, I think what we'll do. Oh, does anyone have questions? Sorry. Okay. So since I've kept you on here, the amount of time, because I try to respect your time and then make the homework match the hour and a half, I'm going to stop sharing. It doesn't mean that we're not going to watch the 3-minute video, but we'll do that next week. So that, again, we respect each other's time. Lupita is going to remind me, if she has a moment, on my email, and just say, Miss Amanda, don't forget. And I'll do what I said I was going to do earlier. I'm going to stop recording right now. So basically next week will probably be our true kind of last class, so that you can have time to study. And I may still post stuff, or we'll have like a discussion board instead, and then we can like answer questions for each other. How about that? So next week will be everything that you guys wanted to talk about and learn. Then I'll give no homework, and then I'll open a discussion board, and basically at that point class is done. You guys can just utilize all of your time for studying for finals. Does that sound good?
Yes.
Okay. And if you disagree with it and you're like, no, I want class, please just email me and I'll do class. And then the other people that they don't have to come, and that's fine. Fair?
Yep.
Not that I
Thank you.
don't want to be with you. I'm trying to be fair because I know it's hard.
Mhm. Okay, Miss Amanda. Hope you have a
Okay.
nice
Push me off, Lupita.
day.
Okay. All right, guys. Bye. Thank
Thank
you.
you so much. Appreciate it.
You're
Thank
so
you.
welcome. Thank you. Bye.